6:53 on this Wednesday morning. Welcome back to Good Day Austin. Pain in the nation, alcohol, drugs, and suicide deaths. The new report out today from Trust for America's Health is shedding more light on how deep the teen suicide crisis is in the United States. Brandon Reavis, Senior Government Relations Manager at Trust for America's Health, joins us this morning with a look at those numbers. Good morning, Brandon. Thanks for joining us.
Good morning. Thank you for having me.
Yeah, absolutely. So tell us a little bit more about the report. What did it find between 2010 and 2021, specifically even here in Texas?
The report found that in those 10 years, the rate of death from alcohol, suicide, and drug overdoses for youth specifically increased by more than 65%, and the rate of suicide increased by more than 70%. Across the board, deaths from alcohol, suicide, and drug overdoses in the United States for all populations more than doubled in that same time period.
Yeah, taking a look at these numbers, these are really alarming, 71%. What do you think, did the report find reasoning for this?
Certainly the impact of the pandemic had an impact through the stressors like housing instability, food insecurity, emotional and physical abuse in the home. But we also know that these trends have been increasing for decades in terms of suicides and drug overdoses. So we know that mental health for youth is in a state of crisis in this country. And that's why we emphasize in the report the need to increase funding for services in schools to address the root causes of some of these issues.
Yeah, Brandon, do you have any of these numbers specifically for Texas, or is that within the report that we could take a look at?
We know that for Texas, the state has one of the lowest combined death rates. For example, drug overdose rates in Texas were less than half the national average. But we also show in the report that the increase in the rate of overdoses due to synthetic opioids like fentanyl more than 3 times the national average, which suggests that the increasing presence of fentanyl in our drug supply is really having a significant impact on Texas communities.
Yeah, absolutely. Taking a look at the note from the report, it said specifically suicide rates are up, especially in communities of color. What policy changes or programs are needed to address this?
We noted in the report that we need to diversify our behavioral health workforce to make sure that there are providers who can provide culturally and linguistically appropriate services. We also need to strengthen our crisis intervention services, including through the new 988 Lifeline, to also have mobile crisis units to meet people where they are during a state of crisis, and stabilization centers so that individuals have a place to go and that they're also able to avoid intervention by law enforcement.
Yeah, Brandon, why do you feel the need to tailor interventions for specific populations? What's the data behind that?
We know that when people are given access to providers who have the same lived experience or can communicate in culturally and linguistically appropriate ways, that really does improve the effectiveness of treatment. And that's especially true when we're talking about recovery from drug addiction and other mental health issues.
Yeah, Brandon, what were the key takeaways finally from this, the key findings?
The report is really a call to action to policymakers. We know that there are evidence-based programs and policies that can address these issues. And it's especially important to not only reduce harms and transform our mental health system, but also make investments in the social and economic conditions that can prevent mental health conditions before they start.
Yeah, absolutely. If anybody is interested in taking a look at state-by-state data or taking a look at the full report, where can they go?
They can go to tfah.org, and we have full tables on state data.
Okay, Brandon Reavis, Senior Government Relations Manager at Trust for America's Health. Thanks so much for joining us this morning.
Thank you, Leslie.
And we'll be right back.